So this is a very unique test, and it looks at the nervous system that we don't have control over, called the autonomic nervous system. Our whole body is meant to be in balance. So we have this nervous system that has two major components. One is the sympathetic, which is our fight or flight. It reacts when we have stress. It reacts to get us to move. It forces our adrenaline so that we can get our blood pressure up, our heart rate up, get blood to our muscles so that we can move to get out of danger. So it is our fight or flight response, and it saves us most of the time. To balance that, we have the parasympathetic, which is our rest and our digest portion of the autonomic nervous system, and that lowers our heart rate and lowers our blood pressure. And heart rate variability basically is the balance of these two systems. So one makes your heart rate go up and one makes your heart rate go down, and heart rate variability is about the up and down of this heart rate. And so what we want for an autonomic nervous system is a balanced HRV, which shows both up and down kind of variations. Our test that we do in the office looks to see if patients come in with what looks like an uncut grass pattern, up and down pattern. A lot of our patients come in what looks like the lung has just been mowed. It's very flat because either one system is overfiring all the time, the stress response is overfiring, your fight or flight is always on, and this system, which is your recharge, which is your rest and digest, usually falls to the wayside. So if we were to have a battery charge on our chest, like our phones do, we would see that a lot of us are walking around with 4% or 7%, and we want to plug ourselves in. So part of it is this is a visual for you to see, are you plugging yourself in enough so we can bring that system back into balance.